Physicians often recommend that patients with urinary tract infections increase their fluid intake. The theory behind this recommendation is that increasing the fluid intake will increase the amount of urine that's produced, and this will help to flush out the bacteria. Some early studies has found that more frequent urination reduces the amount of bacteria in the urine. However, studies examining whether the increased urination reduces the incidence of the urinary tract infections has not yielded conclusive results. Regardless, poor fluid intake is a risk factor for recurrent urinary tract infections in females. An increased fluid intake does appear to be protective against more serious upper urinary tract infections that can affect the kidneys. Some behavioural changes can help to prevent urinary tract infections, particularly in children. Recurrent UTIs in female children are associated with infrequent urination, delaying urination after the urge to urinate manifests, and delaying of defecation, but not poor bathroom hygiene. Similarly, women who delay urination for more than 1 hour post-urge have an increased risk of developing urinary tract infections, and this suggests that urinating shortly after feeling the need to urinate could help to prevent urinary tract infections. Avoiding diaphragms and spermicides as contraception methods can also help to prevent urinary tract infections. Although some sources suggest urinating shortly before or after intercourse can also help to reduce a female's risk of developing a urinary tract infection. There's no conclusive evidence that frequent voiding or voiding after intercourse significantly reduces the UTI risk. Other behavioural interventions that may help to reduce the risk of developing a urinary tract infection include wearing cotton underwear, avoiding tight-fitting clothing, and wiping from front to back to prevent the transportation of bacteria from the anus to the urethra. Cranberries contain substances that can help to treat and prevent urinary tract infections. Cranberry juice powders made from cranberry extract have been used for decades to prevent or to treat urinary tract infections. Originally, it was hypothesized that one of the components in cranberry, quinic acid, increased the levels of natural antibacterial agent in the urine, known as hypuric acid. However, it's not clear if there's a significant increase in the hypuric acid level in the urine after cranberry consumption. Evidence suggests that substances known as proanthocyanidins, which are found in the cranberries, might interfere with the adhesion of the bacteria, particularly E. coli, to the walls of the urinary tract. By preventing the E. coli from binding to the urinary tract cells, the proanthocyanidins can keep the bacteria from fully colonizing and invading the urinary tract. One of the advantages of using cranberry juice or related products is that cranberry is relatively inexpensive, natural, and should not contribute to the growing problem of antibiotic resistance. One study found that both cranberry juice and cranberry tablets were effective at reducing urinary tract infections when compared to placebo in women who developed at least one urinary tract infection per year. This study also found cranberry tablets were a more cost-effective option compared to cranberry juice. Another study found consuming cranberry juice 3 times per day produced a trend towards reducing the incidence of urinary tract infections during pregnancy. Yet another study compared cranberry extract to low-dose trimethoprim, a commonly used antibiotic for the prevention of the recurrent UTIs in older women. The study found the regular use of the drug was only slightly better than 500 milligrams of cranberry extract daily for preventing the recurrence of the UTIs. It also found that women taking the drug were more likely to withdraw from the study due to the side effects. Although there's many studies that have examined the potential benefits of cranberries for UTI, one recent review concluded the benefits of consuming cranberry juice were minimal. However, many of the studies included in this review used sugar-laden cranberry juice cocktails. The high sugar content and the fact that many of the beverages are blends of different juices reduces the proanthocyanidin content, and this can obscure the benefits from cranberries. D-mannose is a sugar, and it can be found in, among other things, cranberries. One of the interesting aspects of D-mannose is that it's able to bind to the cells that line the urinary tract and prevent bacteria like E. coli from adhering to the lining of the urinary tract. Much like cranberries, blueberries also contain compounds that inhibit the adhesion of E. coli to the cells that line the urinary tract. In addition, both blueberries and cranberries contain compounds that are able to help prevent large aggregates of bacteria from forming. The clinical effectiveness of blueberries for UTIs has yet to be thoroughly investigated though. Beneficial bacteria that reside in the gut and positively impact the health of their host are a promising natural treatment for UTIs. There's many possible ways that probiotics can prevent UTIs. They might compete with other bacteria for resources, secrete natural antibacterial chemicals, and prevent pathogenic bacteria from adhering to the urinary tract. Bacteria in the Lactobacillus family, normally found in the female vagina, are thought to prevent urinary tract infections. Taking antibiotics or using spermicidal agents can kill off these lactobacilli, which can then increase the risk of UTIs. In addition, recurrent UTIs are often associated with decreased levels of lactobacillus bacteria and increased colonization with E. coli. As a result, supplementing the vaginal flora with probiotic lactobacilli may represent a viable technique for preventing UTIs. In particular, there's evidence that Lactobacillus rhamnosus and Lactobacillus reuteri strains are clinically effective. Lactobacillus bacteria also can prevent UTIs by stimulating the immune system and producing substances that kill infectious bacteria, such as hydrogen peroxide and lactic acid. A study comparing Lactobacillus bacteria to regular dose of trimethoprim antibiotic combination found the antibiotics were only slightly more effective than the probiotic treatment for uncomplicated UTIs. However, probiotics were more effective in complicated cases, which was likely due to the presence of baseline antibiotic resistance in these cases. The authors also point out that probiotics had the advantage of not increasing the risk of antibiotic-resistant microorganisms. Berberine, a chemical that's known as a plant alkaloid, has historically been used in Chinese and Ayurvedic medicine. It can be found in many plants, including golden seal, Oregon grape, coptis, barberry, and turmeric. Berberine has natural antibacterial properties, and it's effective at inhibiting the growth of many opportunistic pathogens like E. coli. Some studies have found that berberine prevents E. coli from adhering to the cells that line the urinary tract, thus providing a possible mechanism for action for its UTI preventative properties. One study suggests that berberine might represent a new target for the development of pharmaceuticals. Berberine might not be safe for pregnant women, however, because it can induce uterine contractions and it may cause jaundice in newborns. Although berberine has been studied in human clinical trials and it's shown to have several metabolic benefits, concerns about the long-term use of berberine have been raised on the basis of certain pre-clinical studies. Some evidence suggests long-term use of berberine, especially at high doses, might impair particular aspects of cellular metabolism in specific type of cells, so for this reason only short-term use would be recommended. Hibiscus is a family of plants that's traditionally been used to treat many different infections, including urinary tract infections. Hibiscus plants contain many compounds that have antibacterial, antifungal, and antioxidant properties. One compound in particular, joycepetin, has been shown to have antibacterial activity against common urinary tract infection causing bacteria, including E. coli and Pseudomonas aeruginosa. In a double-blind, placebo-controlled clinical trial, 61 women with a history of frequent UTIs were randomly assigned to one of three groups, receiving a daily dose of 200 mg of hibiscus extract, standardized to 90% polyphenol, 200 mg of hibiscus extract, standardized to 60% polyphenol, or placebo. Compared to the control group, the women who were taking the hibiscus concentrate experienced a 77% fewer incidence of UTIs, as well as an overall improvement in urinary comfort. Vitamin C, also known as ascorbic acid, is one of the most commonly used vitamin supplements, and it has a variety of effects on the human body. One potential benefit is it may acidify the urine, and this helps to inhibit the growth of infectious bacteria in the urinary tract. The acidification might also convert bacteria nitrates into nitric oxide, which is toxic to the bacteria. In addition, vitamin C is important for the formation of the immune system. Studies have found taking 100 milligrams of vitamin C daily during pregnancy can reduce the incidence of UTIs. Urinary urgency and/or frequency is often associated with a UTI, and to this end, for those afflicted by the UTIs, especially chronic UTI sufferers, taking steps to improve the bladder tone and support healthy voiding patterns can be beneficial. Although not specifically studied in the context of UTIs, pumpkin seed extract has shown to support bladder function and combat the symptoms associated with an overactive bladder. In an animal study, rats who supplemented with pumpkin seed extract exhibited significant improvement in bladder function and decreased urinary frequency. In a human study involving 39 postmenopausal women, 6 weeks of supplementation with pumpkin seed extract plus soybean germ extract led to significant decreases in daytime and nighttime urination. In a similar study among 45 men, the same combination extract led to reduced nighttime urination and improved sleep satisfaction after 6 weeks of supplementation. For more on herbs, supplements, and natural treatment plans, check out my website.